increased risk of importation of the disease. Honorable Speaker, the epicenter of this outbreak is in DRC and Congo. As per our last situational update, the Democratic Republic of Congo has reported 1,083 suspected cases and 259 deaths. Of these, 321 cases of May 20 event that poses a risk to other countries and requires a coordinated international response. Kenya has therefore activated the national preparedness system in accordance with our constitutional duty to protect the right to health, our obligations under the Health Act 2017 and the International Health Regulations 2025. Honorable Speaker, before I respond to the many questions that you have asked me to answer, let me just give the country what is Ebola and which type of Ebola is this. Ebola is a severe, often very fatal illness in humans. There are 3 different types of species. There's Ebola, Zaire, Sudan virus, and the current one we have, which is called Bundibugyo virus, which has the capacity to cause large outbreaks. The modes of transmission are many and members. Infection from contact with wild animals. Thereafter, transmission occurs from person to person through blood or bodily fluids from infected persons or dead bodies. Transmission can also occur from contaminated surfaces or objects like bed linen and cloth. Signs and symptoms. The average incubation period of this particular virus, Ebola virus, is between 2 to 21 days. Infected people are not contagious until they develop the symptoms. Initial signs and symptoms are non-specific. Many malaria, typhoid, meningitis. But the symptoms are usually of onset. They include fever, chills, headache, joint pain, muscle pain, vomiting, diarrhea, skin rashes, among others. Bleeding is less frequent and can occur in the later stages. Of this disease. Risk of infection. Countries like DRC and Uganda contacts of travelers from the affected region, family members of the Ebola virus taking care of the patients with Ebola, or people handling bodies of Ebola victims. How do we prevent Ebola? Early identification and prompt referral and isolation of the suspected cases. Basic universal precautions of hand hygiene and gloving in health setups during the routine work. Wearing of the full personal protective equipment when handling cases. The questions that appeared on the letter you addressed, and the first one was the measures by the government to manage and contain the threat of Ebola. Honorable Speaker and members, the government has activated a whole government preparedness and response framework led by the Ministry of Health through the Kenya National Public Health Institute. The National Ebola Incident Management System activated on the 20th coordination decision making. This structure is supported both at the national and county public health emergency operation centers, which remain on high alert mode. Two, under this arrangement, we have also strengthened our surveillance of health facilities within our communities and the points of entry. We have issued advisories to all the 47 counties covering Ebola case prevention, control reporting protocols, guidance on isolation, sample referral, contact tracing, among others. Our rapid response teams, Honorable Speaker, have been placed on standby for deployment where alerts are reported. Government has also enhanced screening at our 26 official points of entry, including our international airports, land border crossings. Yesterday, 2nd June, 1,243 travelers have been screened cumulatively, including the 2,506 travelers who were screened in the last 24 hours. Screening focuses particularly on travelers from the affected countries and high-risk travel routes. To date, Honorable Speaker, the national surveillance system has captured and investigated 22 suspected alerts from across the country. All of them have Naswari, Kiembu, Wachu, Nyeri, Nyamira, West Pokot, Kisumu, 24 hours, Goma, and they were confirmed negative. Honorable Speaker, the Ministry has also operationalized the public communication mechanism, including the national number, toll number 719, which is our public health hotline, to facilitate communities to report, to do public inquiry, and to give health advisory. Public messaging is being disseminated through the national and the county channels in order to educate the public on the risk factors. Honorable Speaker, the second area you told me to address through the letter from Parliament was the preparedness of the public health facilities, the isolation units, the medical facilities, and trained personnel. Honorable Speaker, the House specifically requested a report on the level of preparedness of public health facilities, including isolation units, medical facilities, and trained personnel. And I want to confirm that the Ministry of Health has undertaken facility readiness assessment and continue to strengthen capacity at the national referral facilities and in counties considered at high risk. At the prepared an 8-bed isolation and treatment unit and completed a dry run of how the index case will be handled. The facility has a of infectious. The National Police Service and has 49 beds ready for activation as part of the surge isolation capacity. At the county level, 29 county designated isolation and treatment sites. The Ministry of Health, the Kenya National Public Health Institute, and relevant regulatory agencies are undertaking on-site verification, quality assurance, spot checks to confirm that these facilities meet the required standard for infection prevention, control, patient flow, waste management, staff protection, and emergency referral. Honorable Speaker and members, these facilities are part of Kenya's national public health preparation architecture. They are not established for exclusive benefit of foreign nationals, foreign governments, or any special category of persons. They are intended to protect all persons within the territory of Kenya, including Kenyan citizens, residents, refugees, visitors visiting our country, diplomats, any other person who may require isolation, testing, or treatment based on the medical need and public health risk. This position is consistent with the Constitution, the Health Act of 2017, the Public Health Act, and the International Health Regulation 2005. If any person, which says if any person is identified within Kenya as a suspected or confirmed Ebola case, the correct public health response is to safely isolate, test, treat, and trace contacts within the jurisdiction where risk is. Kenya has mapped a site comprising of 51 epidemiology and laboratories, and these teams are on for deployment to support and field responses. Additionally, 1,069 national and county health workers have been sensitized on Ebola preparedness and response through a very structured virtual sessions. On-site training and simulation drills have been undertaken in Busia County and Busia border, where 60 health workers have been trained, and additional exercises are going on our plan for the county of Turkana and Trans Nzoia. A national tabletop exercise is scheduled for 15th to 18th June 2026 to test coordination, referral, laboratory, and response. Thirdly, Honorable Speaker, you have asked the measures we have activated as a ministry, which I have really enumerated. Honorable Speaker, in surveillance, the health facility and community-based surveillance have been intensified. Ebola case definitions have been distributed to all counties. Rapid response teams remain on 24-hour standby. Counties have also been directed to identify and operationalize isolation facilities, holding areas, and quarantine facilities. At our points of entry, screening has been strengthened through health declaration requirements, temperature screening, symptoms assessment, and referral protocol. Thermal scanners, holding rooms, ambulance institute, and activated in all our priority ports of entry, including major airports and high-volume land border points. On our laboratory preparedness, the virus being an extreme Biohazard, 4 laboratories have been designated for Ebola testing. The National Public Health Laboratory, KEMRI Nairobi, and KEMRI Kisumu, and a mobile laboratory deployed to Busia. These laboratories are equipped for molecular diagnosis with a mobile laboratory positioned to reduce the turnaround time in the border region. However, Honorable Speaker, while laboratory capacity is strong, the current stocks of specialized test kits, reagents, personnel protective equipment, which are estimated to support only approximately the first 200 suspects, are in place now. And this is why additional emergency financing and partner support are required to build a more adequate testing capacity. In infection prevention and control, the World Health Organization has provided 1,000 Ebola PPE kits, which are available in the country and being prepositioned to support preparedness activity. Initial preposition is focused on strategic research hospital, Mombasa, MTRH in Eldoret, Turkana, and other high-risk points of entry. The fourth item was on regional cooperation coordination with our neighbors, foreign governments, and international health agencies. Honorable Speaker, the House requested a report on that. Kenya is working closely with all the affected and neighboring countries, regional institutions, international partners, because Ebola is not a national problem. It's a regional, it's a global security, it's a global public health security threat. The ministry is engaging in cross-border coordination with our sister country, Uganda, with a particular focus on sharing surveillance information, traveler screening, case notification, contact tracing, laboratory referral, and rapid response readiness. Kenya is coordinating, and we have held meetings at the highest level with the World Health Organization, with the Africa CDC, with the IGAD, with the EACC, with the International Organization for Migration, with the US Center for Disease Control, all these at ministerial level, and with other development partners. This cooperation is focused on surveillance, on laboratory support, on simulation exercise, on technical guidance, training, risk communication, logistics, and partner resource mobilization. And I wish to emphasize, Honorable Speaker, that international cooperation does not mean surrender of our national authority and sovereignty. All public health decisions within Kenya remain under the authority of the government of Kenya. International partners provide technical assistance, commodities, financing, training, and logistical support. Regarding the recent media reports alleging that Kenya has entered into an agreement with the United States of government to establish a quarantine facility for US citizens or foreign nationals, I wish to state clearly that Kenya and the US government signed an agreement on cooperation in threat reduction, biological and infectious diseases engagement program on the 24th July 2015. for approval subsequently introduced in Parliament of July 2016. Upon undergoing parliamentary procedures and public participation and the House process, the House approved the ratification of the agreement on the 9th of February 2017. This agreement subsequently entered into force on 6th of April 2017 and has a validity of 5 years. And Honorable Speaker, the renewing of this cooperation was again signed and came into force on the 5th of April 2022, which has a value of 10 years and is valid the 5th of April 2029. Further, on the 4th of December 2025, we again signed a cooperation agreement with the United States of government to strengthen Kenyan healthcare system on our different areas, including digital health, including HIV/AIDS, TB, and malaria. Over the last 23 years, Honorable Speaker, the government and the people of the United States, through the U.S. government health program, has provided close to $8 billion, equivalent to slightly over 1 trillion Kenya shillings in support of the Kenyan health sector. This investment has significantly strengthened our national response to HIV, TB, malaria, maternal newborn, and global health security. The government of Kenya deeply appreciates this long-standing partnership and remains committed to ensuring that the gains made are sustained through the increased domestic investment, strengthened institutions, and successful implementation of the Kenya-US Health Cooperation Framework, which provides a pathway towards greater country ownership and sustainability of our health program. Honorable Speaker, the proposed Ebola treatment and isolation unit at Laikipia Air Base is part of the 23 units to be established in the country as part of our preparedness and response. This facility will jointly be run by the government of Kenya and the US government of Air Force and the entire medical team working together with the Ministry of Health. This proposed facility reaffirms Kenya's position as a medical hub in the East Africa region with a capacity to offer specialized care for complex infectious diseases. I must also inform the House that aspects of the matter relating to the alleged international health agreements and containment arrangements are now before court. Accordingly, and in keeping with the doctrine of sub judice and standing orders of this House, I will avoid discussing the merits of any active litigation. But I will, however, continue to provide this House with the government's public health position and preparedness status. Honorable Speaker, you also asked about the establishment and accessibility of the Ebola disease control and isolation centers. Honorable Speaker.
Wait, how old is the
Thank you so much. Thank you so much mpenzi mtazamaji popote pale ulipo. Hii ni Africa 24 TV na natumai kwamba huu unaona kwamba Ebola Center in Kenya ni Lifesaver ama ni national risk? Kwa sababu tumesikiza yale ambayo waziri wa afya ameweza kuyasema. Unaona kwamba haya yote yaweza kukuridhisha wewe, ndiposa uweze kuungana na serikali kwamba lazima tuweze kupata kituo katika nchi yetu ya Kenya, ama tu ni kuunga tu mkono kwa sababu ya kuwasaidia na kurudisha mkono kwa Marekani ambayo imeweza kukua ikitupa support wakati wote. Hilo ndio swala kuu ambao Wakenya wanajiuliza kwamba hii ni kwa manufaa ya Wakenya au huenda ikawa ni kujizika wenyewe kwa wenyewe, kwa sababu tulisikia rais akisema kwamba tuweze kuwapea marafiki zetu kutoka Marekani, tuweze kuwapea ile benefit of doubt, ama tuweze kuwapea nafasi kwa sababu umekuwa ukitusupport katika sekta hii ya afya kwa miaka mingi, na sasa kama wameweza kuomba ndiposa waweze kupewa nafasi ndiposa waweze kuanza kupewa kitu hicho, basi wacha sisi tuwape kama Wakenya. Lakini unaona kwamba hili swala ni swala ambalo linaweza kukuzia umuhimu wa Mkenya, ama huenda ikawa ni chanzo za kuanguka na kuleta Ebola katika nchi yetu ya Kenya. So ndio swali naomba kwamba tuweze kujadili na tuweze kupeana maoni mbalimbali, hii ikiwa ni Africa 24 TV tunakuletea moja kwa moja, ndipo sasa tuweze kuhakikisha kwamba yote yanapeanwa kwa njia ambayo inafaa. Unapoendelea kutusikiza, kututazama na vile vile kutufuata kwenye mtandao wa YouTube kwenye Africa 24 TV, enda kusubscribe, enda kulike, enda kufollow, na vile vile swali ambalo tunauliza kwamba huenda ikawa huu ndio mwanzo na mwisho wa Ebola katika Kenya hii. Huu ndio mwanzo wa kuanguka katika serikali ya Kenya Kwanza. Hii ndio wakati wa kuonyesha maundugu ama undugu ambao tunaona taifa la Marekani, kwa sababu rais anasema kwamba Marekani imeweza kusimama nasi katika afya, na sasa wao wanahitaji ile, wanasema kwamba it's a favor that we should do for them, tuweze kuwawekea kituo cha Ebola hapa nchini Kenya. Unaona kwamba kituo hichi cha Ebola ni kusaidia maisha au ni kuridhisha tu rafiki ambao ni wa Marekani, ama ni vile vile ni kuadharisha taifa? Hilo ndio swala kuu ambalo tumeweza kuliuliza siku ya leo, lakini tunaomba kwamba tuzidi kuliuliza zaidi na tuweze kuzungumza masuala kama haya. Naomba kwamba tuzidi endelea kucomment pale, ndipo sasa tuweze kuhakikisha yote yanafanyika. Asante sana kwa wale wote ambao wameweza kunadhimisha shughuli hii, na vile vile tunaomba kwamba tuzidi kuyasimama na kuyasema na kuyanena yale neno. Endelea kulike, endelea kufollow, endelea kusubscribe kwenye YouTube, ndipo sasa tuweze kuhakikisha yote yanatendeka na vile vile yote yanafanyika. Asante sana, hadi wakati mwingine tunapokuwa tunasherekea na vile vile tunajiuliza Ebola itaweza kusimama hapa Kenya, ama hili swala litaweza kutatua yale ambayo yote yanaendelea kuzungumziwa. Unapoendelea kutazama kwenye YouTube, endelea kusubscribe, kindly subscribe, ndipo tuweze kuwafikiana na kuwa na uwiano mzuri wa kitaifa.
The House asked whether Ebola disease control and isolation centers have been established in the country. And I want to say this. I hasten to add that there is a significant presence of Kenyans in the affected regions of both DRC and Uganda. Many Kenyans work in Uganda and do business both in Uganda and DRC. And two of our leading banks, KCB and Equity, employ Kenyans who live in that region. In addition, Kenya has approximately 450 specialized KDF officers and servicemen who are in